So the next topic we're going to talk about is body mechanics for moving patients. So the definition of body mechanics is using the body in an efficient and careful way. This involves the use of good posture, balance, and we use the strongest and largest muscles of the body to perform the work. The major parts we will be discussing are the head, upper body, arms, and legs. Posture and body alignment should always be aligned with each other, and posture allows the body to move and function with strength and efficiency. The base of support is always your feet, and that's the area upon which an object rests, so the feet should provide the base of support. A good base of support is always needed to maintain balance. So the strongest and largest muscle groups are located in the shoulders, upper arms, hips, and thighs, and these muscles are used to lift and move heavy objects. So use the strongest muscles of the thighs and hips by bending at the knees or squatting to lift heavy objects. Avoid bending over from the waist when lifting. So bending from the waist involves the small muscles of your back. So if you do need to bend over to help a patient or to lift up equipment or supplies, just don't bend at your waist. Squat down to pick something up, or kneel down, to help the patient, and then stand up. Don't bend from the waist, because that's how a lot of healthcare workers injure those small muscles in their back. Holding objects close to the body and base of support involves using the upper arms and shoulder muscles. So when you do have to carry supplies, or you are sliding a patient from the table, just make sure you hold that object close to your body. If the object is held away from the body, then strain is placed again on the smaller muscles of the back and the lower arms. And again, like I said, a lot of healthcare workers do develop lower back injuries because of improper body mechanics. So rules for good body mechanics: stand in good alignment with a wide base of support with your legs spread slightly apart, about shoulder width apart. Use the stronger and larger muscles of your body, shoulders, upper arms, thighs, and hips. Keep the patient close to your body when you lift, move, or carry them, pull them over onto the bed. And it's best to have, a couple other healthcare workers with you if you do need to slide a patient. You should never move a patient by yourself. You typically need about 2 to 3 other co-workers to help you move the patient. Avoid unnecessary bending and reaching if possible. Always have the height of the bed in alignment with the bed that you're moving the patient to. And you should try to get the beds to your waist level. So when you lean over the patient, you're not either pulling the patient up or sliding them down. And it is kind of difficult because everybody you work with is different heights. So just try to get it at a good, comfortable level for everybody that's there that's helping you. So push, slide, or pull heavy objects whenever possible rather than lifting them. So if you do have a heavy box of supplies or your equipment, it's better to try to push the box down the hall than try to pick it up and carry it. Use both hands and arms when you lift, move, or carry heavy objects. Turn your entire body when you change the direction of your movement. So you don't want to, twist, because again, you could injure the small muscles in your back. Work with smooth and even movements and avoid sudden or jerky motions. And squat to lift heavy objects from the floor. Push against the strong hip and thigh muscles to raise yourself to a standing position. And then lastly, some important things to remember about moving patients. Ask the nurse if there are any limitations or restrictions in position or moving the patient. If the nurse isn't available, you can always find this in the physician's orders, in the patient's chart. Decide if you need a co-worker to help you. Like I said before, it's best to have 2 or 3 people to help. If you do determine you need more than one person, don't move the patient until you have enough help. And if you are, I always tell the CVT students, if you are in the cath lab and the physician is in the monitor room, you can ask them to come in and help you. They typically will come in and help you move the patient. Be sure to keep the patient covered to protect their privacy. This is also one area that we forget about. Be mindful of any tubes, drainage containers, and IVs the patient may have. If they're on O2, if they're on oxygen, just make sure that those tubes, the IV, if they have a Foley catheter, that all of that is not hanging from the side of the bed, so it does not get caught in between the table and the litter, because those tubes will get pulled out then. So you need to be very careful and mindful of what tubes the patient has or what IVs the patient has before you move them. And then always be gentle when moving the patients. Some patients have arthritis, some have osteoporosis, some just recently had surgeries, so you need to be very gentle when you move the patient. We typically use a slide board when we move the patient from their bed to the table. It really helps with larger patients. If you only have 2 people to help move the patient, it just makes it an easier transition for the patient and for the workers that are moving the patient. We will be going into the lab on our next class on Monday, September 9th, after you take the quiz, and we will go through some bloodborne pathogen stations and some body mechanics stations. So you guys will have to demonstrate competency with the bloodborne pathogen stations and the body mechanics stations. What we do with the bloodborne pathogen stations is we do hand washing. You will put on personal protective equipment, and then I will give you a needle and a syringe, and you will just draw up some fluid. And then you will also take turns moving the patient from one table to the next table with the slide board.